I just want to pull out a few themes that I think have come out through the day, from our three excellent speakers and from the contributions that you've made today, in no particular order, and I'm not even going to mention seals or elephants or emperors or any of our mixed metaphors. We heard from Julian earlier today about the importance of the board taking a lead in making sure that patient experience was at the heart of what their organisations do. Julian talked about the way his trust puts patient experience measures above the reporting of finance and activity. They don't see them as incompatible, but it's just in terms of the running order and the importance. On that same point, we heard from that there are still some trusts that don't even look at the patient experience survey, the published information that's already out there. So we have some way to go in that board leadership. We heard from Paul around some of the developments about new media, that it's unstoppable and people are increasingly wanting to share and tell their stories through a number of different outlets. It's quite complicated for trusts to respond to all of those different sources of information, but they do need to take it on. And there's some real powerful ways in which they can begin to listen to those stories and track them and then respond to them. We also heard this afternoon about brand NHS, or lack of brand NHS, needing to have a clearer set of values and behaviours, recruiting for the behaviours that people that are wanting to work with patients and wanting to give something to them. Others said, well, we don't need to do anything more than just use the NHS constitution, the code of conduct, things that are already there that don't get put into practice. We heard from Victoria about the way that John Lewis resolves and addresses complaints, where staff are empowered to resolve the problems, but they're proactive in looking at the issues and preventing them, undertaking root cause analysis, and a lot more that we can learn there. And we heard from patients here today. They don't just want to know that the complaint has been addressed for them. They want to make sure that the trusts are doing something so it doesn't happen again for other people, and that's incredibly important. We've heard some themes this afternoon about making it easier for people to share their views and concerns, particularly in hospitals when they're vulnerable. We heard about the cafes. We've heard about the different outlets for patient stories. We've heard about the various mechanisms like Health Watch and the scrutiny committees. It's complicated, and there is a responsibility on organisations at the top of the NHS, but also locally, to try and stitch that up in the best way that we can. Some said we don't need any more information. We need to act on what's there and make it more transparent and certainly shared with the public and more user-friendly. And there's certainly something to be said in that. And then finally, we heard a lot about the way that older people in particular and other people with long-term conditions are cared for. And although we could do a lot to improve the current system, put sticking plaster and do things better, whether we're doing the right things is a more fundamental question. And there certainly might be a case by if we listen to patients and their experiences and put that at the heart of what we do, then it might be around redesigning the care and support that they get that is the most fundamental thing. And then we can build improvements around that. So those were just some of the things that I picked out. No doubt you will take away other messages, some of which I hope for the healthcare leaders among you, you might start to put into practice. But others, if there are things that occur to you as you go home or you're sitting in the bath, then we'd still like to hear from you as you take those thoughts away. So, Robert, over to you.
Well, thank you, Sarah, and thank you to everyone, particularly our speakers today. I'm not going to draw any conclusions today, that would be quite wrong, but just a couple of observations, I think. The first is we saw on one of our slides a tsunami. I've said this in a different language at other seminars, but I'm sure we all realise in this room, particularly those who've had bad experiences in hospital, but perhaps not all NHS managers know it. There is a tsunami of anger out there crashing down on the National Health Service. Why is it crashing down? Because there's a feeling, rightly or wrongly, that people are not being listened to. Had people felt they were being listened to, I very much suspect that I wouldn't have had to be employed running a public inquiry for what seems like a very long time now. The other thing that's come up today is about brands. The NHS, it's an unattractive word, but the NHS is not only an organisation becoming increasingly loose, one might say, it's a vision and it's an aspiration and it's a value intrinsic in our society. But like any brand, it can be lost, it can disappear. And it can disappear even if 95% of it is running absolutely excellently. And from what we hear, perhaps that's rather an over-ambitious figure. But the culture, and I'm sure this is right, no one will disagree with it, a culture which is satisfied with 95% of things being right is the wrong way around. The brand can be destroyed by the 5% that's going wrong. Hospitals and trusts where everything is going right, if there was such a notional beast, can be destroyed because down the road there is somewhere that is doing it wrong. Because once confidence is lost, look what's happened to banks. It will take longer, I think, with the health service, but not much longer. So it is really important that everyone shares what is good practice. Around this room, I have heard fantastic things going on in different places, and my immediate question to ask is, well, why aren't they going on everywhere? It's rather the same as writing reports. We opened the inquiry with a rather depressing litany of the number of reports there have been and inquiries there have been over the years about disasters in the health service. It will come as no surprise to those of you who have not read any of those reports that many of them recommend exactly the same things, identifying pretty well the same problems. Just change the date on the report and the location, and there you have it. The NHS Constitution strikes me as a pretty good example. 2002, we have come across in our inquiry people who, frankly, it would seem have hardly heard of the NHS Constitution. We are not short of suggestions of the right things to do. The challenge, it seems to me, is to find a way of making sure they actually happen. And the one thing that is clear is that assuming they're going to happen through people's goodwill and good intent is clearly not good enough. Now, how I can turn all that in a report into something that someone can use, I just don't know. All I know is that I've been helped today, as I have been at the other seminars, by the contribution you've all made. And certainly, if any of you feel that there's things you were burning to say and haven't been able to buttonhole, please write to us. And it's got to be in the near future because we are seriously coming close to the end of when we can receive more information. Please feel free to do so. This isn't a public inquiry, Julie, and we are open to what people want to tell us. But thank you very much for coming, and I hope you have benefited at least as much as I have. Thank you.